We'd like to take an opportunity here to talk about moving into the clinical preceptor teaching role, as it is slightly different. Now, preceptors in general keep within the course goals, and they promote the role socialization, student autonomy, and self-confidence that leads to clinical competency. The key here is that we want competencies on the defined course goals. Now, preceptor also has a series of different roles, including management. They manage the performance and reinforce the students' learning. They make observations and assessments of their students' performance on those goals. They explain the basis for actions and decisions made about the students' progress. They answer questions clearly and precisely, hopefully in a non-judgmental way. Are open to conflicting ideas and opinions. They communicate clear goals and rotation objectives. They hold realistic expectations of the students, understanding that many of the students have just moved from an RN role, and they record and incorporate during the assessments into the final evaluation. Essentially, what's observed during the course of their development results in a final evaluation product, and they coordinate throughout this process with the assigned course member. Now, within that, because they are students of the university, there are a series of different things that need to occur. First, the faculty need to review the course syllabus and the progression with the preceptor. That you review expectations prior to meeting with the student, just to make sure that you understand where the students are supposed to go. That you use the established evaluation criteria for performance standards and communicate any problems that the student may have meeting those standards. Then most certainly you collaborate with the faculty on problem, conflict management, substandard care, unsafe clinical performance, and professional misconduct. Now, we do ask that you reinforce what was well done, and you teach general principles, not necessarily specific content. You clarify the expectations and goals and refine those goals and outcomes as the rotation progresses. You provide feedback that is immediate and constructive, allowing the student to make changes in their practice. That you schedule patients in such a way that it maximizes both your and the student's productivity. That you share students with other practice partners for unique learning opportunities. There's no problem with transferring the student to them for a day or a specific learning objective. That you inform the patients the student is seeing them, and please remember that they always have the opportunity to say no. And then you review the entries in the medical record and provide feedback on their notes. We'll give you specific instructions about when they can start charting and when they cannot. Don't try to teach them too much. Each student has a certain level of learning that comes with each course in the prior clinical work. Don't have the students see everything you do. There may be some things that are inappropriate, that they're not at the level for, or they don't have the understanding about it. Don't make assumptions about your students' knowledge. Please check with the student and or the faculty. As I said before, many of them are just moving from an RN role. Don't assume that the documentation is adequate. We go through a rather lengthy process of training the students in how to document and document adequately, and would like you to check it. And finally, avoid giving the impression you'd rather not have a student. Before clinical, we ask that you do a series of management steps. Verify the university affiliation agreement and the learning contracts are in place and current. Ensure that the student has a letter of good standing from our clinical placement office. This really verifies that they're trained in CPR, they've met all their vaccinations, and have good background checks. 2, students have contacted preceptors for orientation and rotation. The students don't just show up and start with clinical. They really need to have some pre-contact work with the preceptors prior to doing that. Next, the students have adequate EHR orientation to your agency. Many of the students come from different agencies, and as you know, there's no universal EHR. So we want to make sure that the students are oriented well to that. And review the first competency tool. If you have any questions about that, please feel free to contact us. We'll get in touch and go through the competency assessments with you. We would encourage you to look strongly at the other sections of this ACES Academy to begin to look at how to do those evaluations. And finally, we look about safety circles. In other words, Individuals are not alone with an unsafe student. Whenever a student demonstrates unsafe behavior, you have faculty support. Please identify and discuss unsafe practice with the faculty and then with the students. Describe the process for maintaining safety. Discuss strategies to demonstrate change if possible, and make sure that you keep a record of anecdotal notes and the change process, particularly around safety issues. And finally, coordinate with the supervising faculty. Hopefully that will keep the student and you safe in the practice, most certainly the patients in the practice safe, and we're there to back you up in these critical roles. Thank you.